Evening, it's me, Lucy, just updating you as I have been doing every Monday. My update this week is on the social front. I have been out 3 or 4 times in the last week. I had dinner with Toby and Frank one night locally to where I live. I had a day out with my friends Gemma and James and their 2 gorgeous kids. We went to a place called Petersham Nurseries, which is in the Richmond area. Very nice. It was a nice day out for us all. Yesterday I had my first roast in ages. I haven't had a roast in months, which probably surprises you considering the amount of eating that I do. And that was with my mum. She was here for the afternoon, and yeah, they were all good. Sun was shining, and yeah, just good to get out. Luckily my appetite isn't affected by what's going on at the moment. In fact, the steroids that I take increase my appetite, and you can, as I've said before, you can obviously see the effects of the steroids. Give me my little chipmunk cheeks. That, yeah, quite substantial. So that's the social stuff. Been getting my carers have been coming in as normal, which is really helpful. They do make a big difference to my week. In terms of picking things up for me. And so on the health point, my health has been has had a couple of ups and downs. My main issue has been a problem with my left side. I have had a numb left foot for about a week now. So it's the constant pins and needles in my left foot. And I've been having quite a lot of pain with my left hip, which has been like a dull aching pain, and subsequent pain in my knee, my left knee, which feels a bit more musculoskeletal. So I don't know if that's as a result of the hip not being happy and the foot not being happy. Causes me most pain at night. So that's been an issue. So I've been working with the nurses from the hospice to sort that out. And that resulted me being admitted to hospital on Friday night. They wanted to see if we could sort my pain relief out, and then yeah, ended up going to A&E on Friday night. They wanted me to get an ambulance to central London, which I questioned, because I said, if I call 999, which is what you're telling me to do, can I dictate to them that they drive me to UCLH? And the answer was no. So anyway, I ended up getting a taxi and asking my neighbours to help me. So I packed a bag and my neighbours helped me to get down to the taxi and then get to the hospital. And they were fantastic when I got to the hospital. They had everything organised. So I didn't even sit in the A&E waiting area. They just pushed me straight through. They had a bay in the major section waiting for me, at which point breathlessness has been an issue, particularly since sort of Thursday, Friday. As you can probably hear, I'm struggling a little bit. So I went and had a scan called a CTPA, which is a special scan to look for blood clots in your lungs, alternatively known in the medical field as a pulmonary embolism. So And then I had a number of x-rays of my pelvis to check for any fractures. Then I went up to the ward and I went to the exact same bed on the exact same ward that I was on in January for 2 weeks. So it was like a little home going. So the following morning I had an MRI scan of my lumbar spine. So that's the bottom section of your spine. And I stayed in hospital Friday night and Saturday night and forced my way out yesterday. So that was Sunday. Took a while. Usual suspect of medication takes the time. You can kind of get everything else together, but it's trying to get pharmacy and the ward to release all of the drugs so you can get out. So, and I was very focused on getting out from my roast. It's something I'd wanted to do. So the results of all of these scans that I had, so the CTPA showed that I didn't have a pulmonary embolism, so that's really good. Means that there's no threat of me having a stroke or a heart attack or something like that. That obviously if you have blood clot somewhere in your system, particularly in your lungs, and that shifts or moves, can kill you or it can severely disable you. So that's good news. So they've put me on some antibiotics just to check that, just to be safe, to make sure I don't have a chest infection. I don't think I do, but I'm not a doctor, so I follow their advice. The x-rays didn't show any fractures, so that's very good. That means that no surgeons are going to come and attack me imminently. And the MRI did show 2 new tumours in my lumbar spine. So you're kind of talking about going down to your tailbone, so your coccyx area. I have a copy of the scan. I've got a photo of the scan, and I can see it, and it's in the vertebrae. And the doctors believe that is pushing on the spinal cord, or it's pushing on the spinal column, which means that could possibly be impinging on my nerves, which is causing the numbness. So I received a phone call this morning saying, we want you to come in 2 hours time to come and have a radiotherapy planning session, to which I just couldn't get myself together in time because I live an hour and a quarter by car from the hospital, and I've spent most of today not being able to be awake. They have explained to me that that's the disease working. That's my body and my disease fighting each other, and it's not the medication that I'm taking. It's simply my body's reaction to trying to stay alive, I guess. And it is a struggle. Today I've found it hard because, yes, most days I get a bit of a point where I need to sleep, but today I just couldn't stay awake. So I have an appointment tomorrow to go for a radiotherapy planning session, and I'm hoping that, like with my chest wall here and my spine in the the thoracic area, which sits between your shoulder blades, before they just did one big blast. So they did a planning session with some scans and then did a big blast of radiotherapy to that section in one go. The alternative is they will admit me for maybe 5 nights, and I will then have radiotherapy daily for 5 days. The radiotherapy that I had previously when I was in for 2 weeks in January, which was the full brain radiotherapy, my nubbins, these bad boys. They did those over, my brain and those, they did over 5 days. So it could go either way, but my radiotherapy doctor knows I obviously would prefer to just do it in one blast. And, you know, those things really did make a difference, like the brain stuff in particular. I'm so much better than I was when I was admitted. So I'm hoping tomorrow is a one-stop shop. I go in, have the planning session at lunchtime, and then maybe have a blast of radiotherapy, and then I'm hoping to come home. So Sarah is currently driving up from Devon to take me to this appointment tomorrow, because, as I said, I'm very tired and I just need a little bit of support to get there, I think. So that's it, really. I don't really know how the rest of the weeks are going to pan out. We're supposed to have visitors on Wednesday, but I'm not sure really what's going to happen, so I can't make any plans at the moment. So yeah, it's just another step in the process, and the doctors did some good stuff before, so I'm hoping they're going to do some good stuff again, and hope that the radiotherapy will ease the pain and the symptoms of my left side. And yeah, it was a bit of a shock to hear that I have more tumours further down. You kind of get your head round what you've got, and you kind of get used to that normal, and then you get told there's more. You think, oh, okay, makes sense, you know. That's what cancer does. It spreads. But it's just a bit disappointing. And yeah, as I said, very tired, and also sweating quite a lot. And that's, well, maybe it's because it's the hottest day in February on record. And I wouldn't obviously normally sit around in a vest top like a slob off some daytime TV show. But yeah, I'm hot. I'm sure in more ways than one. All right, well, I'm going to sign off. Thanks for watching. Bye-bye. Have a good week.